Okay, so for procedure for taking heart rate and blood pressure. So first I'm going to start off with measuring heart rate. So doing that, you will need a patient and then some sort of stopwatch or watch or a clock on the wall. So what you're going to want to do is you're going to take your patient's hand or wrist, it doesn't matter which one, whichever you are comfortable with. And what you're going to want to do is you're going to take the first two fingers of your other hand, make sure one of them is not your thumb, and you're going to put it thumb side right under where you're able to flex and extend your wrist on the thumb side right here, and you should be able to feel a pulse right there. You want to make sure you don't use your thumb because in your thumb you can actually feel a pulse, so you want to make sure that you're not feeling the pulse from your thumb, but instead from the radial artery right here. So once you find that pulse, you're going to want to make sure you can feel a consistent and steady beat. So once you find it, you're either going to look at the wall timer or your stopwatch. You're going to want to start it, and you're going to either want to count the beats you feel for 15, 30, or 60 seconds. So once you have that total, if you do it for 15 seconds, you're going to want to times the total you have by 4, and that's going to add up to a minute. If you do it for 30 seconds, you're going to times it by 2 to get your heart rate for a minute. Otherwise, you can do a full 60 seconds and then count it or just have that total number right from there. Your patient's heart rate for normal should be between 60 and 80 beats per minute. Lower or higher may be concerning just depending on your patient, but that is how you find accurate heart rate. Now for blood pressure, what you're going to need is, you're not going to need a stopwatch, but you're going to need a patient, full arm. You're going to want them to either be able to roll their sleeves up high enough we can get right above their elbow, or a thin shirt is okay, but you want to try to be as close to the skin as possible. You're going to want a blood pressure cuff and then also a stethoscope. So once you have all these, what you're going to want to do is you're going to take your blood pressure cuff and you're going to put it around the top here. I'm not going to do it because I'm only one person right now. It's going to be a little bit hard, but you're going to put it on the top of their arm right here. You want to make sure it's not on the crease of the elbow because that is where you're going to want the bell of your stethoscope to be placed. So once you have that, you are going to look at the reader of the stethoscope right here. So with that, you're also going to have your pump. You want to make sure that you're going to be able to easily loosen and tighten it for when you're taking your blood pressure. So once your cuff is on your person, you're going to have your you take your stethoscope, put it on your ears, and then what you're going to want to do is you're going to take that bell of the stethoscope, make sure again that your thumb is not, you're not using your thumb because again of that heartbeat that could hear and kind of mess up what you're trying to hear. So I always recommend the first two fingers, and then once that is there, you're going to put it on the crease right in between that elbow, okay? So once you have all that placed, you're going to pump up your blood pressure cuff to about 180. That's the value I like to use because it is high enough where someone's systolic blood pressure shouldn't be that high. If it is, it's major concern. So once you pump your blood pressure cuff up to 180, you're going to slowly release the valve very, very slowly. And the reader on your cuff is going to go down super slowly. And what you want to hear is the beats. On the blood pressure cuff, you might be able to see the dial like tick like this. You can use that as a measurement, but it's probably not the best way because sometimes that will happen even though it's not, you can't hear the beats. So what you really want to listen for through your stethoscope is those beats. So once you start hearing those beats, you are going to want to note what value it's at. You're going to continue hearing those beats and keep slowly releasing the blood pressure cuff until you stop hearing those beats. The start of the beats is the value for your systolic blood pressure, and then once the beats stop, that is the value for your diastolic blood pressure. Put those together, and that's how you're going to get your blood pressure reading.